got to the point very quickly where I couldn't get through an hour or even a half an hour of a day without being in extreme pain. My disc originally became herniated, I believe, through a snowboarding incident. And I fell pretty hard on my backside. And as my doctors told me later, there was probably the beginning of some disc damage already, but this probably put it over the edge. But I did shortly after that, within a couple of weeks, start to experience some significant pain in my lower back. Very quickly it spread down to my right leg, especially if I sat in one position for too long. If I moved the wrong way, it was unbearable. The procedure that they recommended was a microdiscectomy, which they explained to me was essentially the removal of the small piece of the disc that had become herniated through a very, very, very tiny incision. They would go in, remove the piece of the disc, and then close back up the wound, and that I would have minimal recovery time. I was in bed for a couple days, but I got up very quickly and I moved around. But shortly after that, maybe 2 weeks later, I woke up and started to have significant pains again. I started to think that I might be having some post-surgical problems, but I called up my neurosurgeon and he assured me that everything was as it was supposed to be and this was normal. And sure enough, within a couple of days, the pain had worn off at that point for good. I am happy to report that I have had terrific results and had an extremely, what I would consider 100% successful procedure. I have no residual pain whatsoever from the herniated disc, which is incredible to me given the level of pain that I was in before the operation. Now, 6 years later, I do whatever I want. I snowboard, I play basketball, I keep up with my kids barely, and I'm able to do everything that I in theory should be able to do at this point in my life.